You could remove only harmful antibodies from patient's blood while preserving everything else. That is exactly what immunoadsorption does. Welcome to Transfusion Vital. Today we are talking about cutting-edge apheresis technique that offers targeted immunomodulation with fewer side effects and greater precision. What is immunoadsorption? Immunoadsorption, it is the advanced form of therapeutic apheresis that selectively removes pathogenic antibodies, immune complexes, or specific plasma protein from blood while preserving the useful components like clotting factors and albumin. Unlikely, like in TPE, where the entire plasma is discarded and replaced, in immunoadsorption filters it filter out only the harmful parts using highly specific adsorbent column and return the rest of the plasma back to the patient. How does it work? So the blood is drawn from the patient and it is separated into plasma and cellular component. Then the plasma is passed through a special adsorption column that contain ligands, and these ligands are designed to bind the specific immunoglobulins and immune complexes. Now we left with the clean plasma which is recombined with the blood cells and returned to the patient. So this means there is no need for the replacement fluid, which reduce the risk of volume overload, allergy and the transfusion reaction. There are some example of the immunoadsorption column like staphylococcal protein A agarose column, staphylococcal protein A for the silica column, which is under trail for the RA, liposorba LA15, which use the extran sulfate bound to the cellulose for selectively removal of LDL cholesterol from the plasma. Lipoprotein apheresis. So it's an extracorporeal therapy that selectively removes the atherogenic lipoproteins like LDL or lipoprotein A directly from the blood. It's not just a cholesterol lowering therapy, it's a life saving intervention for patients at extreme cardiovascular risk. So, who needs this? So, this therapy is primarily used for the patient with the homozygous familial hypercholesterolemia, severe heterozygous familial hypercholesterolemia, which is unresponsive to medication, or elevated lipoprotein A with progressive cardiovascular disease, a statin intolerant patient with dangerously high LDL level of the cholesterol. Now, how does it work? This process is similar to the apheresis. Now, blood is drawn and separated into plasma and blood cell. Then the plasma is passed through a lipoprotein adsorption column or filtration system. Now, this LDL-C and lipoprotein A are selectively removed. This will clean the plasma, and then this clean plasma is recombined with the cells and returned back to the patient. So various lipoprotein apheresis techniques are available like dextran sulfate, cellulose column, double filtration plasma pheresis, immunoadsorption method. So here we are seeing the immunoadsorption method in which we are using the lipid filtrate membrane, which is disposable one, which will sieve the dangerous LDL and returning of the remaining blood to the patient. This is a case report of the homozygous familial hypercholesterolemia. It's a 12-year-old boy diagnosed with the homozygous familial hypercholesterolemia who lost his elder brother to the same condition. On examination, eye and corneal arcus is there. Echo shows the LVEF is 60%, and he was on tabrozuvas and other medication which failed the medical line of management. So this patient is referred for the lipoprotein apheresis. Now we will check the patient parameters. Weight is 50 kg and height is 165 centimeters. So the total volume that need to be removed or filtered is 3.5 liter. Now estimated plasma volume is 2.1 liter of the 60% of the total blood volume need to be filtered. priming of the filter with the 1 liter of NS, and the duration of the procedure is 130 minutes with a flow rate of 40 to 50 ml per minute. Now extracorporeal volume is 340 ml, which includes your 160 ml in plasma kit, 140 ml in filter, and 40 ml in the tubing, which is always lesser than 15% of the total blood volume. And we are doing the adsorption method, so we will not require any replacement fluid. So pre-procedure the cholesterol level is 417, and after procedure it will 94, and the normal range is less than 200. So you will see there is a recovery of the patient's parameters. For LDL, this 350 was pre-procedure value and 58 is the after procedure value. And for the lipoprotein A, the 157.6 is the pre-procedure value, and post-procedure is 13.7. So you will see that benefit from this procedure is there is rapid reduction in the LDL and lipoprotein level after each session, and it slow down or reverse the atherosclerosis progression, which also reduces the risk of cardiovascular event, and it is well tolerated for long term and regular use. There are various types of plasmapheresis. We have already seen in our previous videos as well. There is TPE, centrifugation plasmapheresis, double filtration plasmapheresis. So in TPE, it is a procedure in which patient blood is passed through the apheresis machine, filtered plasma is removed, and there is reinfusion of RBC along with the plasma or albumin into the patient. For centrifugation plasmapheresis, it selectively remove and replaced by the human albumin or FFP, or indication of the replacement fluid depend on the TPE which is done in the patient and its diagnosis and clinical parameters. For double filtration plasmapheresis, it is designed to selectively remove the immunoglobulin fraction from the serum and minimize the volume of substitution fluid required. Now, if we compare four types of therapeutic apheresis, which includes your TPE, double filtration plasmapheresis, LDL, A, and IAS, then according to the selectivity, TP is non-selective because we will be removing the whole plasma. DFPP, it is semi-selective. IAS is also semi-selective, and LDLA is also semi-selective. For the plasma processing volume, for TP it is 1 to 1.5 times. For DFPP it is 1 to 2 times. For IAS and LDLA it is 2 to 3 times. For replacement fluid, you will be using normal saline, albumin, FFP in TP procedures. For double filtration method, you will be using albumin and FFP. For IAS and LDLA method, none replacement fluid is to be used. For removal of proteins, removal of all plasma component is done in TP. In double filtration, only the macromolecules are removed, and in immunoadsorption method, only pathogenic immunoglobulins are removed, whereas in LDL A method, LDL other lipoproteins are removed. If you found this content helpful, don't forget to like, share, and subscribe to Transfusion Vital, your trusted source for transfusion science and clinical insights. Thank you, and we'll see you in the next video.